Hi, my name is Michelle and I work at Epilepsy Florida. Today, we're going to be talking about self-care for the epilepsy caregiver. So our mission at Epilepsy Florida is that we are dedicated to supporting those in our local communities impacted by epilepsy. We recognize that a condition like epilepsy can be isolating for a lot of people. It can also be life-altering for a lot of people as well. So we come alongside that individual as well as their family, so caregivers as well, to confront the spectrum of challenges created by seizures. So that is our mission. And our vision is to empower people with the information, education, and comprehensive support services necessary to overcome these challenges. Before we get into how exactly to care for oneself as an epilepsy caregiver, let's begin with some foundational work. What exactly is a seizure? What is epilepsy? Let's begin with what a seizure is. On a regular day, your brain is sending electrical signals to the body. It's doing this so you can move, you can think, you can feel, behave, do anything that you need to do. But imagine if those signals did not function in the way that we expect them to. Maybe they were scrambled. When that happens, we say that a seizure has occurred. A seizure specifically is a brief moment of excessive electrical activity in the brain. So a brief moment of excessive electrical activity in the brain. And it may affect one or more of the following. It may affect movement. Now there's a specific type of seizure that you may have heard of before. It's called a tonic-clonic seizure. For this type of seizure, the person gets very rigid and then they start to shake or they start to convulse. For this type of seizure, it affects movement. We could see that. But there's some types of seizures where it does not affect movement at all. So for tonic-clonic, it affects movement. For other types, it may affect behavior, where that person acts in a way that you wouldn't expect of them. Maybe they seem to be intoxicated or under the influence or just acting out of the ordinary. For this person, it may be a seizure that has affected their behavior. For others, the seizure may affect their awareness. So there's a specific type of seizure that we'll talk about called a focal impaired awareness seizure. For this type of seizure, as the name implies, the person's awareness is impaired or altered while that seizure is taking place. If you were to try to get their attention, try to call their name in some way, or try to just get their attention at all, they're not going to respond to you. There's an inability to respond because they are not aware of what's happening around them while it's taking place. So a seizure may affect that person's awareness or it may not. A seizure may also affect sensation. If it's affecting their sense of smell, that person may say, I smell something that no one else around them is smelling. Maybe they smell gasoline or bleach or roses or whatever it may be, but no one else around them is smelling this smell. Or if it's affecting their sense of hearing, they may say, I hear something that no one else is hearing. Or if it's affecting their sense of sight, they may see something that no one else is seeing as well. So it may affect sensation or it may not. So we know what a seizure is. Now, what is epilepsy? How does that connect? Epilepsy specifically is a chronic neurological disorder. It's characterized by a tendency to have recurrent, unprovoked seizures. And by unprovoked, we mean that it is a seizure that is not due to a treatable medical condition. So it's recurrent and unprovoked seizures. 1 in 10 people will have a single seizure in their lifetime, and 1 in 26 will have this tendency for recurrent, unprovoked seizures. So 1 in 26 people will develop epilepsy in their lifetime. A couple fast facts about epilepsy as well. It is not a form of mental illness. There are quite a few people who think that epilepsy is a form of mental illness. It is not. It is neurological in nature. It is not psychological in nature. It is not a form of mental illness. It is also not an intellectual dysfunction as well. Epilepsy affects 3.5 million people in the US currently. As a matter of fact, around the world, 65 million people have or are affected by epilepsy. It is not a disorder that discriminates in any way. It can happen to anyone at any age. It also does not matter your racial or ethnic background either. It can happen to anyone at any age. For 70% of people who have epilepsy, they actually don't know why they have it. So for 70% of people who have epilepsy, their cause is unknown to them. And it is the 4th most common neurological disorder. So if that's you or somebody that you know who has this condition, please know you are not alone in that. There are more than 20 different types of seizures. However, we're going to talk about some of the most common ones that you may encounter with a loved one. So the first one is a tonic-clonic seizure. For this one, it used to be called grand mal seizures, but since have changed the name to tonic-clonic. What happens here is that the person gets very rigid, and then they start to shake or they start to convulse. So this one affects movement. This is a type of seizure that usually lasts about 1 to 3 minutes typically. Another type of seizure is called an absence seizure. For this type of seizure, the person, there's a pause in activity. The person has a blank stare on their face, and if you were to try to call their name or try to get their attention during this time, they would not be able to respond to you. There's an inability to respond because during that time, there's a brief lapse of awareness. This type of seizure tends to last anywhere between 1 to 10 seconds typically. Another type of seizure is called a focal aware seizure. For this type of seizure, the person is aware while the seizure is taking place. They are fully alert, fully awake, and they may have isolated twitching of the face, arms, or legs. They may have sensory symptoms. They may say, I smell something that no one else is smelling. They may say, I hear something that no one else is hearing. They may have a sudden feeling of fear or a sudden feeling of anxiety out of nowhere, especially when nothing in their environment changed to explain this sudden fear. And then it's usually lasts less than 1 minute. So that's another type of seizure as well. Another type of seizure we want to mention is called a focal impaired awareness seizure. For this type of seizure, the person is not aware of what's happening around them while it is taking place. It begins with a blank, dazed stare, then progresses to purposeless, repetitive movement. So not movement that they're consciously thinking of, just purposeless, repetitive movement. What that might look like is aimless walking, which looks like sleepwalking. They may start picking at things, picking at clothes, nonsensical speech, lip smacking, clumsy or disoriented movement. For this person, if you were to try to get their attention, try to call their name, try to maybe wake them if they seem to be sleepwalking, is they will not respond. There's an inability to respond because they are not aware of what's happening around them while it is taking place. Another type of seizure is called an atonic seizure. Another name for this is called a drop attack. For this person, they have a sudden loss of muscle tone. So you may see them walking as they normally do, and all of a sudden you just see them fall. You just see them drop, as we say. There's a sudden loss of muscle tone for that person. Another type of seizure is called a myoclonic seizure. For this type of seizure, there's jerking on both sides of the body. You may see both arms jerking upwards, and this type of seizure tends to happen more so in the morning than other times of day. So those are common seizure types that you may have encountered before or a loved one may have. So how exactly does epilepsy affect the quality of life of the individual? So firstly, the type of seizure can vary from person to person, so that may also affect the quality of life that person has. Someone who has an absence seizure, which maybe it lasts just a couple of seconds and their recovery time is very quick, may have a different quality of life than someone who has maybe tonic-clonic seizures and their recovery time is much longer, and there may be injury that they have sustained during one of their tonic-clonic seizures. So their quality of life may be different depending on the type of seizure the person has. Another factor that may contribute to the quality of life of that person is the frequency of their seizures. So whether someone has maybe one seizure a month versus someone who has a seizure once every day can affect their quality of life as well. The age and stage of life may affect the quality of life as well. So whether someone is maybe a younger person who is being cared for by parents, they may have a different quality of life than someone who's maybe older and has dependents, who has epilepsy and has dependents, people who they are caring for as well as they care for themselves with this condition. So it may be very different for each person. Another factor to consider is comorbidities. Does this person have a mental illness? Do they have depression? Do they have anxiety? Do they have maybe autism? Do they have any other comorbidity that may affect their quality of as well, in addition to this epilepsy diagnosis? Another factor is whether or not they have breakthrough seizures or intractable epilepsy. Is this person able to find a treatment that works for them and they no longer have seizures for quite some time? Or is this person trying to figure out a treatment plan that works for them and they are still having breakthrough seizures? That could affect their quality of life as well. Another factor to consider is financial constraints. Can this person afford health insurance? Are they able to easily access a neurologist, their medication, information about epilepsy, or is it hard for them to access this information or access these services? Do they have health insurance? Do they not have health insurance? These types of things could affect the quality of life for that person as well. How exactly can epilepsy affect caregivers? Now that we know how it can affect the person who has the condition, how can it affect the people who are caring for this person with epilepsy? So we have some scenarios. Maybe one of these resonate with you. So the first one being James and Naomi. Now, James and Naomi are parents of 3 children, Adrian, Mark, and Natalie. And Natalie is their youngest, and she has epilepsy at 6 years old. She has tonic-clonic and absence seizures specifically. James and Naomi are constantly being called away from work by Natalie's school. Every single time she has a seizure, they call the parents to come pick her up. The parents, James and Naomi, have explained to the school that a seizure is not always an emergency, and yet they still continue to call them. So they have to take time away from work to go pick up Natalie and take her home consistently. That causes some stress and some burden to them. They are also constantly worried about when the next seizure will take place and what will happen. Will Natalie be injured badly this time? Will they have to go to the hospital? Will their insurance cover it? Are some of the questions that they ponder on a regular basis. They have to say no to certain activities, both for themselves and for their family as a unit. They worry how Natalie's siblings are coping with the attention that they have to give her specifically constantly. They worry about the ways in which she'll be able to cope in the long term. Will she be able to be independent and working and able to live on her own? And seeing their little girl convulse for 2 to 3 minutes, no matter how many times they've seen her have a seizure, every single time they see her have a seizure, they feel some distress for themselves, seeing their daughter having to deal with seizures. They feel as though they're in a constant state of stress and sleeplessness. And then we have scenario 2, a little bit different. So we have Miriam and David. They are parents of Jesse, a now 25-year-old who has recently graduated from college and is working at a great job. He loves his job. And then out of nowhere, without warning, Jesse starts having seizures and develops epilepsy. He is diagnosed with epilepsy. Within a year, Jesse has to quit his job. He's moved back in with his parents, and his parents are supporting him financially because he's having memory loss as well related to the seizures. Miriam and David are grateful that they're in a position that they can care for their son, that they can financially support him even now. But they're now grieving the life they thought he would have, the dreams, the aspirations they thought of when they watched him grow throughout the years. These are things that are now limited in some ways, especially when they see some of their peers and his peers advancing in certain ways that are now somewhat limited for him. They often feel guilt and wonder if they did something wrong along the way. They are anxious about what the future will hold for them when they are gone, and Natalie has to fend for herself potentially, and they feel unprepared to deal with the emotional toll of some of the side effects of his medication. Unfortunately, with some of his medication, though it's helping with his seizures, it also causes him to be irritable, to have angry outbursts, to have rage in some instances. So they have to not only care for him with the epilepsy, but with some of these side effects as well, which is causing them some stress and burnout too. Now, caring for someone with uncontrolled epilepsy can be like living in a constant state of danger. There will be another seizure, but no one knows when. Even for those who have witnessed hundreds of seizures and know exactly what to do, seizures generate stress. Someone they love is in distress. Something different could happen this time. So what exactly are the sources of stress for someone who is a caregiver of someone with epilepsy? First of all, the very nature of epilepsy and of seizures means that it's unpredictable. You don't know when it's going to happen, especially if you don't know what triggers a seizure for that person. So the unpredictability, not knowing when it's going to happen, can cause some considerable stress to the caregivers. The financial stress as well of diagnostic tests. Do they have insurance? Will it cover it? How much will it cover? Are things that they have to think of. Medication, hospital stays, having to take time off of work, using their PTO to go and pick up their child because she just had a seizure at school or whatever it may be. The emotional stress of having to see their loved one in distress during a seizure, no matter how many times they've seen their child or their loved one, the person that they care for, have a seizure, it still has a toll on them emotionally. And also navigating the emotional aspect of their loved one living with this chronic condition. Often with chronic conditions such as epilepsy, it is not uncommon for that person to have low self-esteem, to have depression, to have anxiety, or other comorbidities. So not only dealing with that condition itself, but with other comorbidities they may have as well, and the emotional toll of that. For pediatric patients in particular, the stress related to medication management, ensuring that they take their medication on time, every time, as directed by their doctor, having to advocate for the child, if it's a child at their school, making sure that they have the accommodations that they need, all forms are filled out so that if they need extra lessons or a nurse with them or whatever accommodations they may need, that is in place for them. Dealing with the side effects of some medication. So as we said, with some medication, there may be some side effects that they also have to deal with. It could be irritability, rage, side effects such as that. And for some people, there may even be stress due to resentment. Maybe there's an uneven balance in the way that the caregivers are caring for that child. Maybe one has to stay with them more often than another because the other needs to go and work so that they can pay for the treatment and the medication and such, and have health insurance. So there may be some imbalance in how the child is cared for, even though they are both caregivers, and that can build some resentment for some caregivers as well over time. For many caregivers, they also experience isolation and a dwindling of their social life. So that's not just reserved for persons with epilepsy, but for the caregivers as well. Those are things that they experience too, where they notice maybe that their child isn't invited to the sleepovers all the time because maybe the parents of the other children are afraid that their child will have a seizure while at their home and not knowing what to do. Maybe friends and family members stop coming around as much. They stop engaging as much since the diagnosis has happened. They haven't said anything, but you see them less and less and less. That has been the case for many people. For some, there may be emotional burnout as well due to anxiously wondering how the loved one will cope in future, especially when that person is gone, when that caregiver is gone. Maybe they have passed away or they've moved away or whatever it may be, that ongoing grief for the life they imagine for their loved one as well. So how can you care for yourself? That's why we're here, right? To talk about how you can care for yourself as an epilepsy caregiver. The first step tip that I want to give you is to recognize the magnitude of what you're dealing with on a regular basis. Just because you are not the person who has epilepsy does not mean that there isn't stress and emotional burnout that you are also dealing with. So recognize that your mental health also matters, that the magnitude of what you're dealing with is great as well. Where possible, if you haven't done so already, establish a support system and schedule time to do what you like to do, right? Find that hobby that you really like and see if you are able to do it. There's a lot of online options now. See if that's something you can do. Maybe you can do something online to be able to have that time for yourself still. Join an epilepsy caregiver support group, whether it's a parent support group or for family members of persons with epilepsy. Find out from your local Epilepsy Alliance America chapter if there's a support group that you can join. Again, with that, many of them are online as well. Go to counseling. There are many different chapters that offer not only counseling for the individual with epilepsy, but for the family as well. So find out as well from your local chapter, your Epilepsy Alliance America chapter, if they have neuropsychological services available too. Reach out to your chapter to see what resources might be available to aid in financial assistance, because that might be available and you might be eligible for that as well. Gain some peace of mind by educating your family, maybe your child's school, and other persons involved in the life of your loved one about epilepsy, about seizure first aid. Learn more about the medications that they have and the side effects, so maybe you might be able to manage them better knowing more about them. You can contact your local Epilepsy Alliance America to get more information on these different topics as well. Also, you can find out about possible respite care that might be available to you. Plan for the long term by helping your loved one to become an independent decision maker if possible and where possible. Exercise, because exercise is good for the body, especially for mental health, and look for whatever positives you can see. And if you don't see any, create some for yourself. Maybe you want to go bowling, but you don't necessarily have persons around you who want to go bowling. Find out from other caregivers, epilepsy caregivers, especially if they would want to join a bowling team and go bowling together, just as an example. But look for positives, and if you can, and if you don't see any, try to create some for yourself where is possible. I hope that was helpful for you. If you know anyone who has epilepsy or suspect that they do, please do reach out to us. We would love to be able to talk more about it. Or if you just want more information about what we discussed today, please do reach out to us. We welcome the request.